Tonight's newsmaker, Dr. Linda Colvin Rhodes, director of Mercyhurst University's Hirtzel Institute on Health Education and Aging, joining us now to talk much more about this. Dr. Colvin Rhodes, thank you for coming in. Appreciate it. Good to see you again.
Yeah, thank you very much, John.
Why does Mercyhurst offer health career camps?
Well, one of the things that we had been hearing from hospitals, medical centers, doctors' offices, and nursing homes that they just didn't have enough of a culturally diverse workforce, and they wanted to have more minorities working for them. And we also noticed in our programs, we have a lot of allied health and nursing programs, that we too were not getting enough minorities who were applying. So we did a little research and realized that young people they're just not aware of all the kinds of health careers that are available to them. They think, well, it's either you're a nurse or a doctor. And so we thought, you know what, why don't we set up some health career explorer camps and have these kids come on campus and practice some of these careers so that they would be aware of them in the first place.
How long has Mercyhurst been offering the camp?
Well, we've been doing this now for 6 years. We received funding from the Department of Labor and Industry in Pennsylvania to start them, and this past year, we really want to thank the Hammett Health Foundation because they funded the camps. We've actually going to have 50 kids, both in middle school and high school. So over the past 6 years, we've reached about 500 students that have gone through a health career summer camp.
That's some nice numbers there.
Yeah.
So what do the students do exactly when they're at these camps?
Well, one of the first things that we do when they come in is that we want to treat them as a professional because they're really going to practice these skills so that they're given an official set of scrubs that they get to keep, a stethoscope that they wear around their necks and their name badges, and then we take them into labs, and so they actually work in these careers. They work on these really high-end human patient simulators so they understand nursing. They work in the medical lab that we have, and they're looking through these pretty high-end microscopes. Today, we took them on a field trip. They went to UPMC Hammett, and they actually saw a live hernia operation using that Da Vinci robot, and they were pretty psyched about that today. So they get all of these really great experiences of actually practicing that different career.
Now, this Friday, the students will be producing public health newscast. Can you tell us about that?
Yeah, one of the things that we do at the end of their that week, we have like a capstone event. It's a graduation. We invite parents and also the public and our faculty to come. And this year we thought, a good way would be to get the kids interested in the controversial topics that you just opened with. Mm-hmm. And so what we do is we give the kids video cameras and they go out and they videotape responses and we really turn them into health reporters. And so we're going to have this really cool mock newscast. Maybe some of them will be a health reporter for JET someday.
Hey, you never know. I imagine, we just have a few seconds left, but I imagine the kids are pretty pumped up and headed, some of them at least, toward health careers.
Yes, we're actually seeing, we started, we planted these seeds through middle school, and so it takes a while, but we're actually seeing students now applying to our programs and other programs in the region, which we think is really important. And I think one of the incentives, too, is at the end of graduation, they all get a $2,000 scholarship. They graduate to high school and apply to any of our programs. They get a $2,000 scholarship.
And that's a good incentive. Dr. Linda Colvin Rhodes, we appreciate it. Best of luck with the program.
Thank you very much.